Hi everyone, welcome to the next episode of Thoughts in Education. Today we have Dr. SHYAMA Nagarajan with us. I would like to welcome her. Hi ma'am, let's start with an interview. So, can you tell me about your education background, ma'am?
Thank you so much for this interview. I'm pretty excited to talk to the students through your channel. And formal namaskar, sat shri akal to all my friends who are listening to us. So myself, I am SHYAMA Nagarajan. I am basically a medical graduate, trained in VSS Medical College, Sambalpur, Burla, in Noida. And thereafter I did my Masters in Hospital Administration from the esteemed All India Institute of Medical Sciences. And then post that I did my Masters in Public Health as well, and went ahead to do some specific training on sustainable financing and health education, and moved into various kinds of organizations that I have worked with. Probably one of the blessed ones to have all kinds of experience from both public and private sector, corporate sector, and donor partners. I've worked with various organizations in leadership positions like ICRA, which is the credit rating agency, the World Bank, then Fortis Healthcare as their Chief of Quality, then moved to Ernst & Young as their EY, as their health practice lead, and currently heading one of the organization which is a niche healthcare consulting firm called SHYAMA Nagaran, and serving as Executive Director to the Academy of Hospital Administration. So an overall around 28-29 years of journey in health sector purely. Thank you.
Alright ma'am. Moving on to my next question. When you first came in your institute, what was your vision for the institute, and has it evolved over time, and how far along in implementing that vision are you?
Okay, so before talking about the vision of Academy of Hospital Administration, one needs to understand how AHA was conceived. So AHA was conceived way back in 1984 in the All India Institute of Medical Sciences, Department of Hospital Administration. The then visionaries in this country, who actually Professor A.N. Safaya, Professor Sinha, Professor Sarma, and the late Major General Muninder Shrivastava, they all thought that there is a need to bring about or to strengthen the hospitals the way it is operating, the health systems the way it is operating, and therefore they thought that there is a need for a specialty like this, and therefore organization needs to be created where we bring all the experts that are required to make a hospital together. So that is how the idea was laid down, and 1987 the Academy of Hospital Administration was formally registered under the Societies Act, and from there on the intent was always has been one, that is that you create leaders for tomorrow to handle hospitals in their changing scenario. And the way the technology has changed, the role of administrators today has changed, that today what you see is not an administrator who is just an administrator or just a clinician, but a techno manager who can lead and steward the policy related changes in the country to support the health system strengthening and making it more resilient to address to the growing needs of the community. If you look at the pandemic today, you would have realized that we all thank the doctors, we all thank the nurses and the paramedics whom we are seeing in the front. But all these at the back end, somebody had been directing, making it happen. Those are the hospital administrators who did meticulous procurement, meticulous budgeting, financing, administration, managing the entire scheme of things. So hats off to the administrators who have done this work, and Academy has been fostering this, and I think over these years we have been very successful in achieving that.
Okay, that is so good to know about your vision towards the university and vision. So moving to my next question, what do you see as a university's greatest strength currently?
Okay, that's a very interesting question. Our greatest strength is our expertise, our set of people, our set of domain experts. This is one of the unique bodies which can applaud itself to have all kinds of experts who work in the health space. That is, from doctors, nurses, paramedics, pharmacists, architects, engineers, lawyers, all come together to help health sector to move to the level that it is today. So if you were to see, we can actually boast about the strong network of CEOs and CXOs in the country, across the country, that are there, who can help bring about real knowledge sharing for the students, which generally is not possible for most institutions. And if you see, we have 13 local chapters and over 3,000 members across the country, and we have got 50 institutional memberships like that of IIMs, AIMSs of this country, all the AIMs, and including your other research institutes like the PGI Chandigarh and similar kind of institutes across the country, which are a part of our institutional members who actually contribute significantly to the growth of hospital administration.
Well, thank you so much, ma'am, for giving your valuable insights and time to us. We truly appreciate it, and it is truly inspiring for us. Thank you.
Thank you so much. Look forward to meeting you all again. Thank you.